102.5 FM, the voice of Arkansas Minority Advocacy Council, or our underwriters or sponsors.
Good morning, everyone out there, and happy rainy Friday to you. You're tuned into Community Conversations with Quabila Harden and Ms. Micah Simone.
Good morning, everyone.
And our very special guest is Dr. Amy Shollenbarger from Arkansas State University. I'm so happy I got that right. Today we're going to be discussing, let me back up. She is the interim department chair for the Department of Communication Disorders at Arkansas State University. So we're going to be talking about all things communication, speech, and things of that nature. And then there's a clinic on the campus that deals with speech.
We provide speech and language therapy services.
Okay, and so we're going to be talking all about that. But before we get too deep into that, I would like for Dr. Amy to please give a little background about herself, since this is your first time here with us. So let the people know who you are.
Okay, well, my name is Amy Shollenbarger, and I have been at Arkansas State University for 6 years. I came on just as a faculty member, and I'm starting my second year as the interim department chair.
Okay.
And my background is in providing speech-language therapy in the public school system, and so I did that for 16 years, and then I went back to school and got my PhD, and now I'm at Arkansas State University.
Alrighty. So where did you come? Have you always lived in Arkansas?
No, I'm a Texas girl.
Okay.
I was born and raised in Texas and graduated from high school there.
Okay.
And then I came to Arkansas and went to Harding University for my bachelor's degree, and then I came to ASU to get my master's degree.
Okay.
And then I also got my PhD in the consortium program that's in Arkansas with UCA, UAMS, and UALR.
Alrighty, well, I'm sure Arkansas State is very happy to have you and have your expertise here, so you can pass on the education to the students. So let's get into exactly what does the Department of Communication Disorders, what do you do in particular? Like, you know, some people might think, okay, I want to do speech pathology, speech therapy. Just tell the people, what does that department include?
Okay. So we have an undergraduate and a graduate program. So undergraduate students can get a bachelor's degree in communication disorders, and that degree is preparing them for a master's program.
Okay.
And then once you go to graduate school and complete that, then you can become a licensed speech-language pathologist. And so we offer audiology classes at the undergraduate and graduate level, but we do not offer the AUD program.
Okay.
So our students do get some experience with hearing assessment, hearing screenings, oral rehab, but we don't provide the audiology degree. They can go to another graduate program for that.
Okay. And so on an average, like, how many students, well, I don't know, like, I'm sorry, I'm trying to ask this, about how many students really, get into this field? Do you feel the numbers could be higher, or?
Well, we saw a map not too long ago of the number of speech-language pathologists per population, and Arkansas is very well supplied with speech-language pathologists. So if you need speech therapy services, language therapy, voice therapy, swallowing therapy, you have good access to licensed speech-language pathologists in our state.
Okay.
In our program, our graduate program, we typically have cohorts of 26 students.
Okay.
And it's a 19-month program. So.
Wow, that's pretty intensive.
What is the success rate within those graduate classes, or courses, I should say?
Well, since I've been here the last 6 years, we've had 100% success rate with graduation, and then our students take what we call the praxis exam. It's the national exam that they have to take to get their national certification. We've had 100% pass rate on that. Our students all find jobs. It's really a good field.
So that is a testament to how well you are preparing your students for life and work outside of Arkansas. So you're preparing them, you're equipping them with the tools they need to take these exams and pass, not just pass, but excel.
Yes.
That is
and
so wonderful.
a big part of our program is the clinical side of it, the clinical education side of it. And so that's where our speech and hearing center comes into play.
Okay, so let's get more into the services, break down the different services you offer, how they benefit individuals, what is involved in that particular service. Like you mentioned before, swallowing. Some people might not think that's a big deal. So please explain what that entails, why it's important to maybe learn or relearn those skills.
Okay, so the clinic is on campus in the Don W. Reynolds building.
Okay.
And it's a free clinic to the community, but it's a teaching clinic. So the primary focus of our speech and hearing center is to prepare our students to go out and be competent speech language pathologists. So we try to provide them a wide variety of experiences in their clinic placements and with the type of clients that they see. So we will have clients from the youngest I think we've had since I've been here was 2 years old, all the way up to 80. So we serve children and adults.
Okay.
And we have children who just need articulation therapy, learn how to produce sounds correctly. We have had clients who have fluency disorders, so we can treat individuals who stutter or have other types of speech fluency disorders. We work with adults who've had strokes or traumatic brain injuries and try to help them regain communication skills, language skills. And then we also have Shannon Brantley is one of our faculty members who specializes in voice and swallowing disorders. And so we have equipment in our clinic for assessing and treating swallowing and voice disorders as well.
Oh, that's wonderful. I'm looking at the page, well, one page on the Arkansas State University's website, and the services you offer is just amazing. And there's information on here on how to obtain the services, and we'll make sure to get that information out before the show is over if anyone is interested in at least going for a consultation to see if they can benefit from the services, or even if they need the services that you have to offer.
Yes.
So whenever your students graduate, the field that they go in, they can either go into a hospital setting or a school setting, or it seems as if it's very diverse. Could you elaborate on some of those?
Yes, so when you graduate with a master's degree in speech language pathology and pass the praxis exam, you do what's called a 9-month clinical fellowship year. So you have your job and you're being paid, but you're also under the supervision of a licensed speech language pathologist. And then once you finish your clinical fellowship year, we get what we call our certification of clinical competence. And at that point, you're on your own. You can go and get it in the world. But we provide services the whole lifespan. So some of our students may be interested in working in the NICU unit in the hospital with the tiny babies and helping in that setting, or you can work in preschool settings, you can have private practice, you can work in hospitals, nursing homes, schools. There's a lot of opportunity. Some speech language pathologists want to be involved in the entertainment industry, and so they'll provide voice therapy services to speakers and singers and actors. So it's a lot of fun.
I never thought about it on that level.
Me
that
either.
People who speak for a living need to. So what would that entail? For someone who is a public speaker, singer, actress, whatever. What would a session entail with them?
Well, it depends on what that individual needs. Some may come to us because they have vocal nodules, which is a voice disorder from using and abusing the voice, and so we would teach them better voice habits to have a better voice quality. So that could be one thing, or maybe if they're maybe they need to work on projecting their voice and sounding confident, so we can do that as well. Or maybe they want to not sound like they're from the southern, country, or they want to work on their accent reduction, we can do that as well.
Really?
Yes.
So if someone is studying another language, it's good to go to a speech pathologist to work on that.
Well, we can. Generally, now when you think about second language learners, their language, when they're learning English, is not a disorder. It's just considered a second language. And certainly we can help, and we're willing to do that, but since it's not disordered language, that's not our primary focus.
Okay.
All right.
Understood.
I'm just really interested to, as you're talking about the different services, never thought about finding ways to protect your voice no matter what you do with it.
Yes.
Think about us here on the radio. We have to, use our voice. So we have to be mindful of taking care of it, I guess. I never thought about.
Yes, it's not uncommon for teachers, preachers, trying to think of other professions where you use your voice all the time.
Politicians?
Yes, politicians could. Yeah.
Oh, goodness. Well, okay.
So what do they usually come to you for within, I guess, those arenas? What do they come? They come for the swallowing
We
therapy?
have probably our students are required to be exposed to lots of different disorders.
Okay.
So it's easier, I think, to get referrals for childhood speech and language, so articulation, language fluency. It's harder to get referrals for swallowing and voice, even though we're equipped to deal with those.
Okay.
So we want our students to really learn how to provide services in those realms. And so one good thing about our program, students work in our clinic on campus, but they also go off-site and go to different settings in the community or across the state of Arkansas. We've had them go to Colorado. We've had them go to Walter Reed Hospital before to get clinic experience.
Do you, during the course of their studies, from freshman to graduate to PhD, do they also have to study how this is done in other countries? Global.
We do. We have a class where we focus on multicultural issues in communication disorders. So, in articulation disorders course, we study different languages and dialects and the sounds, the phonology of the different languages. When you're doing assessments, to be mindful that if a person is from another country, they may not even have certain English sounds that we produce in their language at all. And so if they can't produce it, you can't say, oh, they have a speech disorder. It's just that's part of their language.
Okay. I want to say good morning to Dr. Sharice Jones-Brents for checking in with us. Thank you for watching. And everyone else out there that may be watching and listening. If you have any questions, please give us a call, 870-277-1080. And we're also streaming live on Facebook and YouTube. So please drop your questions and comments and we'll be happy to address them. Okay, so take us through a typical session. I see that it says the facility operates on a per semester basis and is closed during final exams, which is, understandable. Yes. And between semesters, resuming services shortly after classes begin to ensure proper supervision and training for each student, as well as appropriate and ethical services to every client. A limited number of clients can be admitted each semester. These admissions are based on the needs of the individual, facility accommodations, and student competency needs. Self-referrals are allowed.
Yes. Okay. So in the summer, our clinic is open from 1 to 5 on Monday through Thursday.
Okay.
And then in the fall and spring semesters, we're open from 1 to 6, Monday through Thursday.
Okay, so can you walk us through what a typical, once the patient's referred and accepted and they come to their first visit, what are some things you work on with them?
Okay, so say that you have a child or a family member who you think needs services. So you call our clinic. and I can give you the number
Okay.
for it. It's
Okay.
972-3301.
Okay.
So you call the clinic and you can self-refer, or we take referrals from other individuals.
Okay.
And then once they're put on the schedule, they're assigned a clinician, a student, and then
Okay.
that student works with her supervisor in planning what the first session will be. And generally, it's going to involve assessment, so they'll be doing some evaluations to see exactly what needs that person has. And then once the assessment is complete, they write a treatment plan,
Okay.
set goals and objectives, and then from there, the therapy is provided, always focused on meeting those goals and objectives.
Okay. I have a question concerning children. You know, there's some children, I don't know if this goes back. Okay, there's some children, they talk when they want to, and some they talk all the time, but then they can't, even say at 3 and 4, they're still not formulating their words in the way that most people think they should. So can you help us understand, why do some children talk later? Not talk at all? Is it they don't know how, they don't want to, like?
It can be for many different reasons. You know, some children are late talkers,
Okay.
okay? And then some children may have older siblings who talk for them,
Okay.
so they don't really have a need to talk, where other children really are delayed.
Okay.
Parents really need to work with their pediatricians
Okay.
to have the pediatrician kind of go with them and check developmental milestones. And then I would say once a child is 2 years old, if they're not producing, starting to produce some 2-word phrases,
Okay.
you might have the doctor go visit your doctor and check, or you can always contact a speech language pathologist to do a screening.
Okay.
They can do just a quick little screening to see if there's a need for further testing.
Okay. Have you ever ran into children that, you know, like I said before, they just simply don't want to? Not that they don't have the capability of using their voice, speaking, you know, they just simply, I don't like you, I don't want to talk to you. Type of, you know, how do you work around children who seem, I don't want to call it stubborn, they're just kind of
We have
reserved.
we know a lot of behavior management techniques,
Okay.
and we try to figure out, so if we get a child in the clinic who is non-compliant,
Okay.
is that kind of what you're
Yes,
asking?
ma'am. Yes.
We have different strategies that we use to try to improve behavior
Okay.
in positive ways. So that's something that our students get a first taste of every once in a while.
Okay.
And we tell them it takes a long time to get really good at dealing with behavior, but we try to mentor them through those instances when they come up in the clinic.
Okay.
Going back to what you stated about the assessment before they actually form a treatment plan, how is the assessment done, and does it vary from age to age? Would it be a conversation for you and I?
It depends on what the client is coming in for. So if we get a referral for a child who might need articulation therapy, so maybe they're 6 years old and they can't say their L sounds or their SH sounds or something like that. So we would give them articulation tests. We have standardized tests that we would give. The graduate student would administer those tests and then score them. And we would look at the scores and see if they're normal or below average. And then from that, we can formulate the treatment plan. If they're a language client, we would give language tests. If they come in for voice, we have a FEES system, a fiber optic endoscopic evaluation of swallowing, and there's a flexible scope that our students learn how to pass up through the nose, the nasal cavity, and peer down at the vocal folds. So you can look at vocal function. You can watch how the vocal folds move, or you can pass it on down and look at swallowing as well. So we have that assessment.
When you say pass down, just to be clear, that means they're gonna like stick it up your nose. Okay.
Yes. The flexible scope. Yes, it goes up through the nasal cavity and then down through the pharyngeal cavity. And you can watch. It's really amazing.
All right, we're going to have to take this conversation up when we come back from the break, so please do not go anywhere. We'll be right back after these announcements.
You're listening to Community Conversations on KLEK 102.5 FM. We'll be right back.
What do you do when you're not in the mood? I'm Mark Merrill with today's Family Minute. When we talk about what a good marriage takes, we like to focus on the basics. We talk about loving our spouse, caring for our spouse, and spending time with our spouse. And while those things are certainly important, there's a huge part of marriage that we don't talk about as much, and that's physical intimacy. When you're married, you're called to love your spouse in every way, emotionally, spiritually, and physically. So what do you do if you're not in the mood? Have that sexual intimacy anyway. On today's Family First podcast, my wife Susan and I will address what to do when you're not in the mood. Join us at markmerrill.com. Remember, your family first.
Want to connect with Mark on Twitter? You can. Follow him at twitter.com/markmerrill.
Family Minute is made possible by the Kappa Nu Omega chapter of Alpha Kappa Alpha Sorority Incorporated, a non-profit organization committed to service to all mankind. Kappa Nu Omega Alpha Kappa Alpha on Facebook and KNOMEGA1908.com.
Meineke of Jonesboro is now Starks Auto Service, a full-service auto repair and vehicle maintenance center, offering engine and transmission repair, brake service, tires, oil changes, and more, performed by ASE certified mechanics. The all-new Starks Auto Service, 2813 South Caraway Road in Jonesboro, 870-204-7112. Starks Auto Service, Jonesboro.com.
When a woman gives her all to her boyfriend, she is hopeful about the future. Marriage was in her future plans until she received some shocking news. Now with her dream shattered and life altered, she has to pick up the pieces and move forward. It was in this experience that she realized that love has no protection. KLEK 102.5 and Massey Production presents the inspirational gospel stage play, Love Has No Protection, a story that would inspire you, renew, and reaffirm your faith. Featuring performers from all over Arkansas, Texas, and Louisiana, 7 p.m. Saturday, June 24th at the Arkansas State University Student Union. Tickets are $10 in advance, $15 at the door, and can be purchased at KLEK, Cool Cuts, and online at www.klekfm.org or by calling 870-277-1080. Bring the entire family Saturday, June 24th to the Arkansas State University Student Union to see Love Has No Protection, the inspirational gospel stage play, 7 p.m. This event is a KLEK fundraiser.
Just added a special 3 o'clock p.m. matinee show. That's right, now it's going to be 2 shows, 3 o'clock p.m. and 7 o'clock p.m. The hit gospel stage play, Love Has No Protection, coming to the ASU Student Union Centennial Hall, June 24th. Don't miss it.
Fullness of Joy Ministries presents I Am Her, Healed, Empowered, Restored. Women's Conference, Friday, June 23rd through Sunday, June 25th at the church, located at 2120 Thorn Street in Jonesboro. This event will be hosted by co-pastor Elder Susan Rogers. June 23rd will feature Lady Tina Smith at 7 p.m. June 24th at 10 a.m. is the Her Forum, addressing mental, physical, and spiritual health of women. June 25th will feature Apostle Berlinda Helms at 11 a.m., and June 25th will feature Pastor Alice Nolan at 7 p.m. More information is available via Lisa Brown or Lorinda Lockhart at 9569.
Did you know KLEK has a brand new streaming app? That's right, you can listen to KLEK 102.5 FM anywhere in the world. The app is available for all Android phones and tablets, as well as iPhones and iPads. Just search your app store for KLEK and download the KLEK app for free today. And don't miss a beat of the education, entertainment, and empowerment on KLEK 102.5 FM.
And now back to Community Conversations on KLEK 102.5 FM.
All right, welcome back to Community Conversations on KLEK 102.5 FM. We're speaking with Dr. Amy Shollenbarger from Arkansas State University. She is in the Department of Communication Disorders, and we've been talking a lot about what this degree, what someone can expect when they get this degree, a degree in, say, communication disorders, what type of job they can have, what facilities they can work in. The field is very diverse. I mean, they can go anywhere and do anything related to speech and communications. And I'm also looking at some more information on your website, on the Arkansas State University page. And this is talking about what is a speech language pathologist. You know, you touched on that earlier. And then this also goes into working with people who've had a stroke, brain injuries, hearing loss, developmental delay, a cleft palate, cerebral palsy, or emotional problems. So let's break down, you know, some of these. We've touched a little bit on, you know, stroke. We talked a little bit off air about that. And a stroke affects people in different ways, everyone in different ways. Some people still have a lot of their cognitive skills. They can still function as normal, as they normally were. And then there's some people that are affected so severely that they have to relearn a lot of those simple skills. So take us through what it's like working with a stroke patient.
Okay, well, in your brain, you have a right hemisphere and a left hemisphere.
Okay.
In most people, generally, the left hemisphere is the dominant hemisphere for language.
Okay.
And so if you have a stroke in the left hemisphere of your brain, depending on where in the left hemisphere, you can develop different types of aphasia, is what we call it. So if your stroke is more posterior in the left hemisphere, so more towards the back of the brain, you can have what we call a fluent aphasia, where the person is able to talk and they say lots of words, but what they're saying may not make sense, and their comprehension is in decline. So you can talk to them and they act like they know what they're saying and they're having a conversation with you, but they really may not grasp what you mean, and what they're saying doesn't make sense to you. But then if you have a stroke in the more front part of your left hemisphere, you can have what we call a non-fluent aphasia, where you comprehend everything, you know what's going on, and you know what you want to say, but you have great difficulty getting the words out. And so that's different. And if you have a stroke in your right hemisphere, you have all different kinds of characteristics. You can have what we call left neglect. So some individuals who have a stroke in the right hemisphere completely ignore anything that's on the left side of their body, and that has to do with the brain injury. So we're trying to teach our students through classes and clinic, when they're lucky enough to get to work with a patient who's had a stroke, to try and do different strategies and therapy techniques to help them regain function.
From your experience, have you ever met a patient that had total loss of speech that has gotten at least, I'll say 50 to 75% better through the course of treatments?
We always want to. There's this thing called neuroplasticity. Our brain, we have neuroplasticity in the brain, and anytime you learn something, your brain changes. And so while there are individuals who've had a stroke, may not ever regain all of their function, or even get back half of their function, there's always things that we try to do to restore some communication. So say you have a stroke and you're nonverbal, you cannot speak anymore, maybe that person can use AAC device, an augmentative communication device. So with technology now, iPads, you can download apps that have communication boards and things. So if a client can learn how to use that, or there are others available that you can purchase, or maybe the client can use gestures if they're not able to use a lot of words. So it just depends. You know, some strokes, the impact of them are much more severe than others, and it all goes back to where it occurred in the brain.
You were talking about the different devices, and it's very interesting to see individuals who, you mainly see this with individuals who are wheelchair bound. They may have cerebral palsy, some other disorder, and they use this tube. It's almost like they blow into a tube. That's
to make their wheelchair move?
Well, no, to make a voice, manipulate speech. And I don't know if that's, you know, just something you see on TV or if that's actually...
No, that's really real.
Okay.
There are eye gaze devices where just by moving your eyes you can activate a device. You can have certain pointers. You know, you can wear a band. There's lots of different ways you can access device if you don't have the dexterity in your fingers to do it. So
I guess I'm just interested to how it works as far as using your mouth or blowing or however the process works into this device, and it then speaks or it types something.
Well, the client would have to know how to access the information on the device. Most of them are trained. You know, a lot of individuals with cerebral palsy cognitively can be fine. It's just they have the other motor impairments, and maybe they're not able to communicate verbally with their mouth, but they're perfectly able to access a device.
And then individuals with cleft palate, is that common in the United States? Or do you see
No, I mean, I'm trying to remember what the prevalence is. I'd have to look that up. It's not as common as some other disorders, but the cleft palate team in the state of Arkansas is in Little Rock. And most babies who are born with a cleft palate, by the time they're 12 months old or 15 months old, have had surgery to repair it.
I'm just interested how that affects their speech. Can you explain exactly what it is?
So a cleft palate is when there's an opening in the hard or soft palate in the roof of your mouth. And so it can be just up nearer to your teeth, your upper teeth, or it can go all the way back. It just depends on the width and depth and length of the cleft. If it's just in the hard palate, which is the bony part of the roof of your mouth, most of the time when they have surgery and it's successful and everything heals up the way it's supposed to do, then you may not have any more issues. When the cleft goes all the way back to the soft palate, which is a muscle in the back of your mouth, your soft palate functions to go up and close off your nasal cavity when you eat, so food doesn't come up through your nose, and it helps us produce sounds like p and b, because if air comes out through your nose, it's going to be like that. And so it's really important. But kids who've had a cleft palate, sometimes when they repair that soft palate, the muscle function of it may not be perfect, or the length may not be good to close off against the back pharyngeal wall, and so then you have what we call velopharyngeal insufficiency, which makes you have really hypernasal speech, or it can create some feeding issues with food coming and liquids coming up through the nose. So at that point, they would have to go see a surgeon to take care of that. We can help with the speech part of it, but when it's an actual structure issue, an anatomy issue, that has to be taken care of.
Now,
through surgery.
You touched on earlier about individuals that may have stuttering issues. Does that is it a neurological thing, or is it sometimes people get tripped up on their words, or because of some type of emotional issue? Like, what are some of the causes?
Okay. We still, even to this day, do not have a definitive cause for why people stutter.
Okay.
We know that there's a genetic component.
Okay.
It can tend to run in families. We know that there is a temperament component.
Oh.
And we also know that different language factors can play into why a person stutters.
Okay.
So if you have a child who's 3 years old and their language skills are just, wow, they're really exploding and developing, sometimes children in that period will go through a time of disfluent speech. And it's not really because they're stuttering, it's just because their language is developing so fast, and so their motor system, it hasn't caught up enough yet.
Okay.
And so then they can have disfluency. But other children may really persist in stuttering, is what we say. And the thing about stuttering is, if I'm a person who stutters and I'm trying to tell you something, and then you react, I'll say badly, you laugh or roll your eyes or interrupt or act like you're bothered by it, then as a person who stutters, that may make me feel bad. Mm-hmm. And so then the next time I want to talk to somebody, I might remember that feeling. Yes. And so the feeling of anxiety can exacerbate the fluency problem. So it can make me stutter more, and then because I stutter, I have more anxiety, and then because I have anxiety, I stutter more. So when we work with individuals who stutter, we really want to try to help decrease the anxiety and any kind of avoidance they have to communicating, and help them learn to be confident, forward-moving speakers.
Okay.
With children, do you ever run into issues with children that suck their thumb? Does that cause any type of speech impairment?
Well, it can. Sometimes it can create problems with the alignment of your teeth.
Okay.
And create more of a forward placement of the tongue. So we have seen that sometimes.
Is there any way to help those children, or sadly, there are some adults who suck their thumbs, maybe because they started as a child and there's some type of psychological link to sucking the thumb. It's I don't know, similar to sucking a pacifier, or like some people who like blanket. It's a comfort thing.
We can educate individuals about sucking your thumb and kind of some adverse effects that can happen because of it. But once the alignment of the teeth is changed, that's going to have to be an orthodontic issue.
Okay. So at that point, they're out of your care to another. Okay. So I'm also looking at on your website, it's saying there's a spot where it's, what do our graduates have to say about our program? So let's talk about some of the feedback you've gotten from your students over the course of your term at Arkansas State.
I think generally the feedback has been very positive.
Okay.
It's funny, when you talk to students, sometimes they will listen to you with a little bit of, I don't know if I believe that or not. I don't know how else to describe it. And then when they get out in the real world working, sometimes they'll email back and say, "Oh, you were right. You're telling me. Now I get it." And so we've gotten some good feedback. We hear back from a lot of our students who've already graduated, and it's fun to see them and hear kind of what they're doing.
Oh, wow.
Yeah.
That's wonderful. We actually have a shout out, which is the first from Instagram. I posted your picture, and this is from Tasha Cole 84. She says, "Thanks for showing speech language pathologists love." Well, you're very welcome. So, like I said, we try to cover all of our social media platforms. One day we'll do live from Instagram once we get the setup going, but we're trying to engage our community, and our community is not just Jonesboro. We want to inform and educate everyone that is around us, that is listening. You know, you may have said some things that people never thought about. They may now either want to do more research, or not to say they want to go around assessing every family member to see who has a problem, but if they notice something with someone, okay, I know where to go now to get the help that I need. And that's why we do shows like this, to help give people that one little bit, here I am, I'm sorry, the extra little bit of knowledge to help them, you know, in their everyday, or whoever they interact with. I'm sorry, I'm going to stop talking.
Do you find yourself doing that? Do you find yourself, I guess, analyzing people that you come in contact with?
Oh, my husband says I'm bad about it.
What made you get into it? What decided that for you? What was the determining factor?
A long time, you know, when I was in probably elementary school, I wanted to be a teacher.
Okay.
I really loved, I loved school, but then my mom worked at a rehab hospital in Amarillo, Texas, and so I went to work with her one day my senior year, and I job shadowed a speech-language pathologist, and I really thought what she did was so interesting. And I really love the medical part of our field, but I also love the opportunity that we have to work in a school system. Okay. And so I felt like with speech-language pathology, I got the best of both worlds. I got the medical side that I love, the neuroanatomy, the study of the brain and all of that, and then also I got to work in a school system with children.
Dr. Audrey would be happy to hear that you would like me to teach. Have you met Dr. Audrey Bowser from Arkansas State?
Yes.
They were here talking about everything, all things teaching, so she'll be very happy to hear I love teaching, that you love teaching.
Yes.
Okay, so let's talk about how you prepare. You know, we did talk about it today. There's a bachelor's, master's, PhD program, and then there's also an extra component, the audible.
Well, to be a licensed speech-language pathologist, you just have to have your master's degree.
Oh, okay.
You do not have to go on and get your PhD. Of course, anybody's welcome to do that, and then, so you can become a speech-language pathologist or an audiologist. And so if you become an audiologist, you need to get what's called your AUD, your Doctorate of Audiology. Okay. And then you can become an audiologist.
Okay. Now, what can individuals do with their bachelor's degree?
Well, you can become what we call a speech pathology assistant. Okay. So you can work with a licensed speech pathologist and help provide services to children at that time. Or some of them, if you get your bachelor's degree in speech-language pathology and then maybe you decide you don't want to go to graduate school, or you apply and you don't get in. Okay.
Sorry,
that's okay.
Caller?
That's okay.
Hello, caller.
Hello. Hi.
Hi. I was calling about the stage play Love Has No Protection. I was trying to see if you guys have more tickets.
Yes, ma'am, we do. Do you know where the studio is located?
I do not.
Okay, it's at 14...
I'm listening.
Okay, 1411 Franklin Street, which is off of Nettleton Avenue.
1411 Franklin, okay.
And someone will be here up until about 11:30, so you just stop by the office and studio.
11:30 this morning?
Yes, ma'am.
Okay. And do you have a lot left, or you?
There's quite a few, yes, ma'am.
Do you take a debit card, or do I need cash?
No, I think he'll take... I'm sorry, we're live on
We're live on air. Is there any way that we can get a call back?
Just come by the studio. We can handle it.
Absolutely, I'll be by there.
Okay, bye-bye. Okay, sorry. And also, later in the show, I do want to announce we will be giving away some tickets to another event. It's called Celebrating the 16th Anniversary, the Jonesboro Alumni Chapter of Kappa Alpha Psi Fraternity. They're hosting an event tomorrow night. And so we'll be giving away some tickets in the second part of the show. So we'll be looking for the third caller. We'll give away the details on how to win those tickets. So we're going to get ready for a quick break here very soon. So I will pick back up on some information that we touched on in the beginning, and then we'll talk about more about the careers that students can take, career paths students can take once they get a degree in whatever level they choose. So you tuned in to Community Conversations on KLEK 102.5 FM. Now, to win the tickets for the Jonesboro Alumni Chapter of Kappa Alpha Psi's 16th anniversary event, it's a black and white event. We need the third caller with the name of the current president. So call us back during the last portion of the show.
You're listening to Community Conversations on KLEK 102.5 FM. We'll be right back.
We're back with Money Matters. I'm Alfred Edmond Jr. Today we're covering how to read your credit card statement. Let's talk finance charges and/or interest. This is what you're paying for the privilege of borrowing money with your credit card. You do know that credit is not free money, don't you? The finance charge on your monthly credit card statement is the interest you pay on the unpaid balance of your account. The calculation method used to determine the finance charge has an effect on the amount you actually pay in finance charges. The most commonly used calculation method is the average daily balance. 3 things you should know about your credit cards at all times: the interest rates you're paying, the balances you owe, and what percentage of your available credit is currently in use. Your goal should be to keep your total credit in use to less than 1/3 of your total credit limits. Understanding this information is critical to your ability to not only manage your credit, but to also shop for the best deals on credit cards, depending on your financial situation and goals. I'm Alfred Edmond Jr. for Money Matters, a product of American Urban Radio Networks.
Money Matters is made possible by the Jonesboro Alumni Chapter of Delta Sigma Theta Sorority Incorporated, a nonprofit organization dedicated to uncompromising commitment to communities, service, leadership, empowerment. www.jonesboroalumnidst.org.
Money Matters is brought to you by Bancorp South, offering checking, savings, loans, credit cards, and wealth management. 5 locations in Jonesboro to serve you. www.bancorpsouth.com or 870-972-9800.
Hello, this is your girl Allie J, and I want everyone to join me for Kick It With a Cancer. My birthday bash going down June 23rd at Legends Barbecue Smokehouse, 1025 West Johnson Avenue, across from Riceland Foods in Jonesboro. This party is going to be an all-ages affair from 7 to 10 o'clock p.m., and I'm letting all cancers in free until 8:30 p.m. with ID. Music by DJ Mr. Chew. To celebrate my birthday, I'm going to make it easy on your pockets, too. Just $5 to get in for adults, $3 if you're 13 and 17, and kids 12 and under get in free. I told you it's an all-ages family affair, and you know you want to be there, right? And just because it's my birthday, I'm giving away presents to some lucky guests. So come kick it with a cancer June 23rd at Legends Barbecue Smokehouse, 1025 West Johnson Avenue from 7 to 10 p.m. This is a KLEK fundraiser.
The McDaniel Law Firm, 400 South Main Street in Jonesboro, is a firm believer in justice and equality for the minority community. The McDaniel Law Firm has fought for our rights for over 44 years. The McDaniel Law Firm offers legal help for wrongful death as well as trucking and automobile accidents. Bobby and Brett McDaniel are available for a free consultation at 870-336-4747 or at www.mcdaniellawyers.com.
Arkansas Early Learning prepares children up to 5 years old for kindergarten by offering a secure learning environment, qualified teachers at several locations in Northeast Arkansas at no cost. Applications are available at arearlylearning.org.
Arkansas Early Learning is a nonprofit organization.
The Jonesboro Alumni Chapter of Kappa Alpha Psi Fraternity Incorporated is celebrating their 16th anniversary, Saturday, June 24th at Sue's Kitchen, 524 Church Street in Jonesboro. The theme is An Evening of Elegance and Achievement. This event is a black and white affair, and formal attire is required. There will be a keynote speaker, full course meal, DJ, and live band. There will also be an award ceremony and the presentation of the Alpha class of KLEK. Sponsorship opportunities are available and donations are also accepted. Information on tickets, sponsorships, and more are available at jonesboroalumni@gmail.com or 501-803-6678.
KLEK thanks Toe Daddy's Towing and Recovery for supporting our mission. Toe Daddy offers towing services for residential and commercial clients. Phone number 870-203-9920. More details available by email at toedaddy01@gmail.com and on klekfm.org. Our motto is, who's your Toe Daddy?
Do you like the music you hear on KLEK 102.5 FM? Do you like the educational programming that we provide? Do you like the service we provide to the community? Do you like having a station to finally call your own that represents you? If so, please stop by or call any of our underwriters or sponsors that you hear on KLEK and tell them thank you for their support. The support of our underwriters and sponsors is vital for us to stay on the air. So be sure to let them know that you thank them for their support.
And now back to Community Conversations on KLEK 102.5 FM.
Hello, welcome back to Community Conversations on KLEK 102.5 FM. This is the last segment. I hope you have enjoyed the information that has been shared today. Of course, you can look up Dr. Amy Shollenbarger on Arkansas State University's webpage. There's more information about the Department of Communication Disorders, and you can see all of the courses and what they have to offer through the clinic that is run. Well, the services are basically done by the students but supervised by their professors, so they're not just out there doing any and everything they want to do. Also, again, we have 2 tickets to give away. We want to take the 3rd caller and the 5th caller to win these tickets. Who is the current president of the Jonesboro Alumni Chapter of Kappa Alpha Psi Fraternity Incorporated? We need the full name of the current president or poll march, 3rd caller and 5th caller. The tickets will be in the studio and you can pick those up today. So, okay, Dr. Amy, let's go back over some information that we provided earlier in case someone missed something, and just give us a rundown.
Okay.
And I'm sorry, one more thing. Let me give the phone number, 870-277-1080. Okay.
Okay, as part of our student education, we have a speech and hearing center on the Jonesboro campus. Okay. It's a free clinic to individuals in the community. It's a teaching clinic. So we are teaching our students to become speech language pathologists. The phone number to the clinic is 972-3301. If you or someone that you know may need speech language therapy services, they're welcome to call. Our students, when they graduate, work in a lot of different settings. They can have their own private practice, work in hospitals, schools, clinics, nursing homes, VA hospitals, rehab centers, lots of different areas. And then you have to have your master's degree to be a licensed speech language pathologist.
Okay, and with the bachelor's, you said that they can at least be an assistant to a pathologist.
Yes.
Okay. Now with now this is something we don't talk a lot about, and when we have individuals on from Arkansas State talking about different careers. Let's talk about salaries, you know.
That's okay.
Some people are like, okay, so that sounds fun, it sounds interesting, but what can I make?
Well, it really depends on your setting.
Okay.
So if you work in a clinic, you can start out making $60,000 possibly a year. If you work in a school system and you're a school employee, like a teacher, you would make general teacher salary.
Okay.
Some schools offer stipends to their speech language pathologists because of billing Medicaid and things like that. But I would think in general, speech language pathologists would make anywhere from $40,000 to $70,000 a year, maybe on average.
And is it possible, when I just thought about this, to go into a research aspect, do research?
Yes, it is.
So stepping away from actually working one-on-one with patients, then you go into the research of how to develop new techniques or technology to help individuals.
Yes, that's certainly an option. Or you may go into designing therapy materials, creating therapy materials and selling them. So yes, that's also.
I would love to see more people with specialized skills develop the tool, the instruments needed for different, whatever area of your life you need something. Someone who has actually trained and knows the anatomy of the body, just say the body.
What advice would you give to an individual looking to do what you do?
Okay, I would, if you're a student and you're interested in speech language pathology, I would really encourage you from the very beginning when you come to college, stay really focused, make good grades. It's a really competitive program.
Oh, wow.
And work hard.
Okay.
But it's a really rewarding field. It's really great to help someone regain communication skills or develop good communication skills.
Do you ever catch the students kind of playing around and doing speech practice, people who sing, they do the la la la, the whatever, the different techniques. So do you ever catch the students practicing techniques on each other?
Yes, that's part of what we make them do too in class. We do a lot of role play, practicing techniques, assignments where they demonstrate techniques in class. So yes.
That's wonderful. Well, we thank you all for tuning in to Community Conversations on KLEK. I guess we have no winners for the tickets for today, so hope everyone has a really great weekend. It looks like the sun is peeking back out, so let's pray the rain holds off. There's so many different events. Don't forget, Kick It With a Cancer tonight at Legends Barbecue and Smokehouse on Johnson Avenue. Doors open at 7 p.m. This is DJ Allie J's birthday party, so it's an all-age family affair. She's giving away gifts on her birthday, so go check it out. Legends Barbecue, Kick It With a Cancer tonight at 7 p.m. Thank you. Have a great day.
Thank you for listening to Community Conversations on KLEK 102.5 FM.